Myasthenia gravis.
Welcome to my channel. I'm sure you all know about Amaka, one of the anchors of The View in TVC News. Let's just listen to her and hear her story with her diagnosis of myasthenia gravis.
All day. I wake up really weak and tired. I can't even press out my toothpaste. I can't even to start my car, to lock my door. You know, the muscles.
Yes.
Yeah, I can't grip. So the little things like maybe opening something, so I find it really difficult to do the basic things. Yes.
So let me tell, before you got to the UK for the diagnosis, share with us some of the experiences in Nigeria with going to doctors when they're telling you different things that they can't figure it out. What was the experience like?
Okay, so yes, because you might think like, okay, maybe you lack, maybe you're having iron deficiency, or maybe you need more calcium. Practically all my life I've taken calcium because I'm always tired. I was that somehow weak child. You know, I was always tired, and so you feel like, okay, you need to take calcium more. You need to increase your iron tablets. Maybe there must be something going on. But the good thing with this whole thing was that I was really sick. I was not a sick child.
Okay.
Yes, because what myasthenia gravis also does is, like, mainly disease enters your body, antibodies already fight it. So before I wasn't that child. I had siblings that were always having malaria, going to the hospital. I was not a sick child.
So just weakness of your
weakness,
muscles.
I always wanted to lie down. I was always, instead of sitting down, you always catch me lying down. I always wanted to rest. And then my father would say, why are you always sleeping off? If you put me in the car, I've slept off. Every minute I want to take a nap. And even if I'm not taking a nap, most of the times I close my eyes. Even my friends tomorrow, they'll say, well, Amaka has already slept off. I'm not sleeping. I'm resting the muscles of my eyes. I always feel like I need to take a short nap. You're unconsciously, you start looking for, unconsciously, a community of people that you start doing your research, like, okay, who has this? What systems are they going through? What medications are they taking? How, when they have a crisis, you know, you start, and then most of the people I found, I didn't find people from Nigeria. They were foreigners, right? The different communities I founded, I found myself in to get answers. I didn't find Nigerians. Then I can remember at some point, somebody now reached out to me and I said, there's a lady, she's a medical doctor, that she thinks that she has myasthenia gravis, but she doesn't live in Nigeria, she stays in Ghana. Because how did she know? She had the baby, and then her body shut down for weeks or whatever. And then
All right, so we have heard her with her team members. So let us now discuss about myasthenia gravis. All right? So myasthenia gravis, in a short form, is grave muscle weakness. All right? It affects the skeletal muscles of the body, and that will cause muscle weakness. You all remember when she said whenever she wake up, she is very tired, you know, to even press her toothpaste, talk less of brushing her teeth. All right? So myasthenia gravis occurs in 1 in 5,000 people, and it is more seen in women that are 20 to 30 years of age, and can also be seen in men that are about 60 to 70 years old. All right? What does this myasthenia gravis do? It affects your extraocular muscle, that is the muscle of your eyes, and it will cause you to have eyelid drooping and double vision. All right? And we all know that when you have all these problems, you're going to be having a lot of challenges. Now, myasthenia gravis is an autoimmune disease, and it is a type 2 hypersensitivity reaction. All right? Now, when you are diagnosed of myasthenia gravis, you should always have it at the back of your mind that you have to start treatment as fast as you can, because you can have what we call myasthenia crisis, and this occurs few years, maybe 2 to 3 years after diagnosis, and you don't want to have this crisis because it is life-threatening. All right? Now, what are the signs and symptoms that you're going to feel when you will now be asking yourself what is causing these problems? All right? Number one, you are going to be having muscle weakness and fatigue. And this fatigue is so heavy and it is going to be affecting your muscles, the big muscle group that you use at your extremities, on your eyes, on your throat. And these are going to cause you a lot of problems because you're going to be having difficulty swallowing. All right? Now, the weakness that you're going to be having, you can wake up in the morning without any problem, but as the days wane, like in the afternoon or towards the evening time, the weakness is going to be worsening. All right? Now, the extraocular muscle weakness that you're going to have in your eyes will make you to have ptosis, or you may have diplopia, which can be either in one eye or on both eyes. There will be limb weakness. The bubble muscles of your body will be very weak, and these bubble muscles are in muscles that are used when you are speaking or when you are chewing or swallowing. All right? So such patients are going to be having slurred speech, difficulty swallowing, and difficulty talking. Now, what are the things that can worsen, things that are going to increase the severity of your myasthenia gravis? If you have infection that is not treated, it can help you worsen your myasthenia gravis. If you have chronic conditions such as, diabetes, hypertension, and every other chronic infection that you have, it can worsen your myasthenia gravis. If you have surgery, okay, or you are in a warm weather, all right, if you are stressed, or you're pregnant, or you're having your menstruation, these are some of the things that are going to be disturbing you when you have myasthenia gravis. So now that you know what myasthenia gravis is, when you have this family or relative or neighbor that is struggling with speech, that is struggling with walking, please tell the person to go have their diagnosis done. And when these diagnoses are done and treatment is started, the person is going to feel better. So treatments include acetylcholinesterase inhibitor, immunosuppressive drugs, and surgery by removing the thymus. So now that you have known, kindly reach out to people that you know so that they will commence their treatment on time. Now, my final doctor's note is take hold of your medical issues, take hold of yourself, and make sure that you visit the right doctor and get your diagnosis and commence your treatment. Stop giving blame to witches and wizards and going around from one hospital to the other that may not know how to make your diagnosis. And the worst of all, stop patronizing churches and traditional healers because they don't know anything about this diagnosis and treatment. Now that you have known, have you subscribed to my YouTube channel? Are you following me in all my social media handles? If you're not, please kindly join us so that you will get first-hand information. This is the only channel where everything that happened in the internet is used to teach you one medical issue or the other. All right? This is your favorite doctor, Dr. Tonia of True Health with Dr. Tonia. My final doctor's orders is health is wealth and knowledge is power. Get that knowledge today and take your treatment and make sure you live a healthy life devoid of illnesses. All right? Thank you. Please like, subscribe, and comment, and please turn on your post notification button so that you will be notified whenever I go live. Thank you for watching. This is your favorite doctor, Dr. Tonia of True Health with Dr. Tonia. Ciao, ciao.